Are you prepared to work, determined to succeed? Then zoom into Strive, Boston's employment service at 651 Washington Street, Dorchester, 02124. For absolutely free, learn the skills you need to secure a job earning a livable wage. We now offer virtual professional development training, including a 30-hour online course over 6 weeks, resume and cover letter writing, interviewing techniques, and job placement assistance. For more info or to register, visit www.jri.org/strive or call 857-251-9852 for youth ages 18 to 24 and 617-862-1287 for adults. Also, upon a successful completion, students will also receive a laptop computer for absolutely free while supplies last. That's right. If you are prepared to work and determined to succeed, then zoom into Strive, Boston's employment service. This is a JRI program, Justice Resource Institute.
Hello, and welcome back to Black Mental Health Matters. I'm Dr. Kerry-Ann Williams, and I'm a psychiatrist practicing right here in Massachusetts. This talk show is about all things related to mental wellness in the Black community. If you have any questions or comments throughout the show at any time, you can give us a call at 617-238-7111. We're also streaming live on Facebook on the page for 98.1 FM, The Urban Heat. So you can join the discussion there, drop a comment on the Facebook live stream. And throughout the week, you can contact me on Instagram at Dr. Kerry-Ann. So guys, I'm so glad you're joining us today for the show. We're going to be talking about how to strengthen our community through family therapy. And I have two guests with me today, Marie Pierre Victor and Liz Brenner. So I'm going to introduce them to you. So Elizabeth, or Liz Brenner, is a licensed independent clinical social worker, and she's a co-director of the Harvard Couples Conference. She's also a teaching associate for Harvard Medical School, and she's a director of Therapy Training Boston. As a director of Therapy Training Boston, she provides continuing education that is rooted in the values of social justice. They're practical, empowering, rejuvenating, and hopeful. Therapy Training Boston stands on the foundation of family systems therapies that are non-blaming, non-shaming approaches to problems and sees people as separate from their problems. The training reflects a commitment to working with all people in ways that demonstrate respect and understanding for the myriad paths that there are to living a good life. Taking into consideration the forces in our larger cultural context that challenge us all. Liz has over 30 years of experience doing family, couple, and individual therapy in many settings: child psychiatric inpatient, residential, home-based, and private practice. She grew up with a father who suffered from bipolar disorder, and that created a lot of disruption in domestic life. So this informs Liz's passion to support families who are struggling. In 2017, Liz was the appreciative recipient of the award for the greatest contribution to social work practice from the Massachusetts chapter of the National Association of Social Workers. My second guest is Marie Pierre Victor, and she is a licensed independent clinical social worker with a BA and an MSW from Boston College. Since 2003, she has been the clinical director of behavioral health at Codman Square Health Center. Her advanced training includes certification in EMDR, which is eye movement desensitization and reprocessing, levels 1 and 2. Also cognitive behavioral therapy, CBT, and she has an advanced certification in the treatment of psychological trauma. Ms. Pierre Victor delivers services in a variety of modalities like individual, couples, families, and groups. Her individual work is mostly with clients diagnosed with complex PTSD, anxiety disorders, dissociative disorders, and mood disorders. Ms. Pierre Victor is the president of the Haitian Mental Health Network of Boston and a past president of the Association of Haitian Women at Boston. And then for the National Association of Social Workers, NASW, which is the largest membership organization of social workers in the world. This August 2020, she was named as a social worker on the front line for the Massachusetts member highlight. She's a parent of 2 young adult males. She's presented on cultural competence at local colleges, local conferences, colleges, as well as on behavioral health integration and primary care. And she sees her own private patients in her own private practice in Canton. So welcome to the show, Liz Brenner and Marie Pierre Victor. Welcome, welcome.
Thank you. It's good
Thank
to
you
be
for
here.
having me.
So excited to talk today about how we can strengthen our communities through family therapy. I want to thank those that are watching through Facebook. Good afternoon, Tamara. So I wanted to start off with, what is family therapy? What exactly is it? And why, why should we even be considering this? So maybe I'll start with Liz. What is family therapy?
That's such a big question. So since both of you took my family therapy course, I'm gonna start, and then I'm gonna ask you what I'm leaving out. So family therapy started as a reaction to what was missing when people were just seen individually in counseling. In fact, there was a time when people were only seen individually, and when kids would go to counseling, and they would do better, and then one of their siblings would end up having difficulties. And so they realized that we all affect each other in families. And if one person changes, it can affect the whole system. And why not bring everybody together and try to support the whole system, and also to help the system support the person who's having difficulty? So the idea was it was also a reaction to psychoanalysis, which sometimes focuses on what's wrong with people. And family therapy, at its best core, focuses on the idea that we all have strengths and resources and resilience, and we all have challenges. And that the most important thing about overcoming challenges is flexibility, that when changes happen, if we're flexible, we can overcome a challenge. And when changes happen, or trauma happens, or life happens, or illness comes upon people, or people are affected in horrible ways by white supremacy and racism and homophobia and all that kind of stuff, that we look at individual resources, the resources in our relationships with each other, in our families, and also the relationship between the individuals and the family and the larger culture, to try to look at what are the patterns that end up happening that can contribute to problems, as opposed to looking at what's wrong with this person because they're having a problem. So we try to figure out what patterns are the problems getting people caught up in. And at its best, we're like an anthropologist trying to understand the culture of each family. And the more, I just want to say, I know I'm a white person on a show about Black Mental Health Matters, and I feel really appreciative that and honored that you invited me. But I think part of what family therapy brings is, because unfortunately, most mental health providers are white, partly because of population numbers, partly because it's so expensive to get and go to graduate school and take so many resources, partly because when you get out of graduate school, being a family therapist is not the highest paid profession. So why bother to, sweat and have all these loans, and then you still can't pay your bills? But at its best, family therapists are facilitating conversations where they strive to understand each individual family's particular culture, their cultural context, and so that our job is not to tell people how to change and fix their lives, but to help empower them to bring the resources that they have to those situations. And one last thing I'll say is that if you have a child that you're concerned about, and you send them, or a teenager, and you send them to an individual therapist, oftentimes they may not even talk about the things that you're concerned about. So it also empowers parents to have an effect on the help that their kids are getting by being a part of it, and also getting support. Because if kids are struggling, they say you're only as happy as your least happy kid, right? So how can we support families who are struggling?
Wow, I like the focus on when you said, it's really kind of about we and not just the I, the individual. It's that there's power in relationships. I like that idea of there being power in relationships, because that's, I think, one of the strengths of the Black community is that power in relationships. And I think when that isn't really recognized, that's when sometimes we run into issues with people not engaging in treatment, is when we don't realize how interconnected our communities are, who's considered family, this sort of thing. So I wanted to also ask, Marie, what are your thoughts about family therapy?
Yeah, thanks. And thank you for having me. So it's great to be here. I really like talking about mental health in the Black community, because it is getting better. There's some improvement, but there's such stigma about mental health in the Black community. And I think quite often, mental health is equated with mental illness. So part of my work is always to differentiate for folks that mental health, everyone wants to have mental health just like we have physical health. And, going to what Liz said in terms of the relationships, the Black community, there's a sense of collectivism compared to individualism that is so much part of white culture, I think. And, talking about the relationships, it's important for providers, for anyone to understand that when you have someone coming to you, it's not just that one person that's sitting in your office. There's also the family. There's also even the extended family. My practice a lot of immigrant communities, and for them often it's not just the family who's here in the States. There's the extended family, and sometimes there's family in their home country, and the family in the home country is quite often just an integral part of the family. So helping folks understand the patterns and the systems and how it can influence the one person who's sitting in your office, that's also part of my work. And it goes along with what Liz said in terms of relationships, understand relationships. And so, there's there's the one family in your room, but then also one for you to understand who else is not in the room, but that's also part of the family.
Oh. And so if we are, talking to the Black community and saying, this is something that might be helpful, what would you say would be some of the reasons why folks in the Black community should consider, family therapy when they're looking for therapy modalities like individual and so on? What should lead them to maybe consider family therapy?
So what I explain to them is it helps them understand. I'm going to use the term pattern that, when I took Liz's course, track the patterns, track. So help them understand the patterns, the forces that are at play that are influencing either the one person coming to me or the child who's the identified patient in the family. So helps them understand that, again, to remove the stigma and helping them, explaining to them that it's not about the negative aspects, what they're doing wrong, but for them to understand how to identify the positives in the relationships and to strengthen those and to bring them forth so they can address the negative aspects. Yeah. So in the sense for them to understand, how do I phrase it? For them to understand the child better, or themselves better, and how the larger culture influence who they are. And when I mean the larger culture, I also talk about white supremacy and the structural racism, for them to understand their reactions in that context.
Oh, so then it kind of helps to have a kind of a broader view and not just this narrow view on like one person who's like the identified patient and you need to go and kind of have this addressed, but rather this larger culture, this larger context of what causes people to have stress and causes them to have any disruptions in mental health, kind of identifying those larger systems. And I like the fact that it's strength-based, at least as Liz has said, at its best, family therapy should be strength-based, and that it promotes the resilience of families. Because I think maybe one of the fears is that, folks are going to go in and they're going to see a therapist that's going to basically tell them that their family is everything wrong. your family is not strong. These are all the weaknesses about your family. But at best, family therapy should be, here's what your family's doing well. Let's build upon those strengths, and let's see if we can leverage those strengths to kind of, work on the areas that need to be worked on.
Oh,
go ahead.
Can I say something about barriers to the Black community accessing family therapy?
Sure, go ahead.
I think, I used to do home-based work in Roxbury and Dorchester, and I was like a child at the time practically. But I was very earnest and determined, and I did really believe that people know how to live their best lives even back then. But I worked in a context where I very quickly understood that there were a lot of systemic forces that might make families reluctant. And where does the stigma come from? I worked in a program where often DCF made the referral to family therapy, and that's complicated because if somebody tells you you need to go to family therapy, otherwise, we might remove your kid, or you need to go to family therapy to get your kid back. I think that's a hard way to start.
Yeah.
And, and also we know that Black families are more highly represented in the DCF caseload because of unconscious bias and all sorts of things. And so I think if people are consumers of family from their own initiative, they can avoid that kind of thing. And if people end up having to be consumers of family therapy because their kids are connected to DCF, because kids are in programs, I think it's really important that people use their voice to let providers know what their concerns are and what their needs are, and try to create a distinction between, okay, maybe I have to do this to get what I want from a system, but really how can I make the best use of this service if it is being imposed upon me? And if it's not being imposed, how can I think about these kinds of things as a resource as opposed to something that's going to be further traumatic and marginalizing?
I like that reframe. The idea of kind of saying, even though this is a situation that we're in, where the referral is under these circumstances, how can we still use it? How can we still kind of raise our voice and kind of be heard and still make the most out of the services? I just want to remind our listeners, you guys are listening to Black Mental Health Matters. I'm Dr. Kerry-Ann Williams, and today we're talking about family therapy and how it can help strengthen Black communities. My guests today are Liz Brenner and Marie Pierre Victor. And if you guys want to join the discussion, you can follow us along on Facebook. We are streaming live on 98.1 FM, The Urban Heat, or you can give us a call at 617-238-7111. So one of the things that I wanted to ask about was whether or not family therapy is adaptable to the needs of the family. Like, are there different kinds of family therapies? And I guess maybe I'll start with Liz.
Oh, I was gonna hope you were starting with Marie, but yes. Would you like to start, Marie? Because
go ahead.
Yeah, I can start. I mean, I can start, and at least you can add. So different types of family therapy, and what I'm thinking, Dr. Kerry-Ann, I'm thinking it's different parts of the family, and maybe, I don't know, maybe Liz can speak to the academic aspect of it. I have started family therapy sometimes with just 2 members of a family. And, whether it's because the other ones weren't ready, they didn't want to, or they were too far for whatever reason. So I have started with 2 members of the family, and eventually I would bring the whole family in. So in terms of building trust and building an alliance like this. And it takes different aspects. So if I'm working with just 2 members, it's really identifying what the issues are, and then what are the strengths of the family, and then trying to engage the rest of them. So in terms of types, I'm not sure, maybe Liz can speak to the different types in terms of, Liz is the academic here on this panel.
Yeah. I
So
think in
there's-
general, yeah.
Yeah, so I'm not going to get too academic, but there's a lot of types of family therapy, a lot of different schools of family therapy, and they all share some similar foundations. The most important thing is that the family therapist is flexible to meet the needs of each individual family member and family as a whole. And I think that that's true of all kinds of therapies, that if you have a hammer and you're using a screw as opposed to a nail, it's not going to work, right? So I think that in all of the therapies that we practice, it's really important to figure out what the client needs. And family therapy has a lot of different ways of working so that we can bring those different ways to different people.
And so is it the kind of situation where if a family is working with a therapist and they kind of say something about the way that this is going isn't working for me, they can actually have a dialogue with their therapist about the approach and say something about this approach isn't working for me. Is there something we can change? You know, even if they don't know all the technical terms, they can say something, you know, they can feel free to be empowered to kind of say, you know, something about your approach isn't working. Let's talk about that. And then that family therapist should be able to be flexible enough to maybe change their approach with the family.
And ideally, there is a whole school of family therapy that's about asking for feedback from the family about how the treatment is going for them and what's working and what else they might need. So that ideally you have a therapist who's interested in gathering your opinion directly. And also when we're doing family therapy, we want to be aware of how is what I'm doing landing on people.
Yeah.
And we're going to be course correcting all the time.
All right, so what I wanted to talk about a little bit too was the idea of making space in the therapy room, so to speak, kind of like just emotional, psychological space for issues of racial identity. So if you have a family, maybe they're a Black family, maybe they're mixed, you know, they're people of varying races in one family, and you have a therapist that may be Black, maybe white. What are some of the, I mean, is it possible for, you know, people of therapists from all backgrounds to really work successfully with families from all backgrounds? And you know, I know, Liz, you've kind of taught on some of these things, and Marie, I know you're practicing some of these things. So I wanted you to comment on how you make space in that room for issues of racial identity, talking about race and families, and for people bringing their whole selves and their whole cultures. Maybe I'll start with Marie. How do you do that in your work? And then Liz, how do you do it and how do you teach it?
So how I do it, in terms of the way I set up my sessions, the initial session is with the kind of the whole family, and I do that a lot with couples. So with, you know, whoever's present, whoever is willing to engage in counseling, and depending on the number of folks, I try to have some individual time with each person in terms of addressing issues, whether it's, you know, racial identity, even sometimes gender identity. I'll touch base on that in the individual sessions, just to get a sense of, is this person really motivated to work on family? Is this person, what are the issues that they're seeing and what are the strengths of the family? Because sometimes initially some members of the family may be quiet or silent, and I need to have an alliance with them so I know, okay, what is it that from their perspective? So that, and then from there, then that's how I do it. And then once I have everybody back as a family, then I try to raise that in terms of the whole family session. What are the issues that they see? What is it that they want to bring up? But in my individual sessions, that's when I also coach them in terms of what is it that you want the rest of the family to know. So that's how I address some of that. And can anyone successfully work with any type of family? I'm not sure. What I know is, you know, Liz talked earlier about course correcting. When I do family therapy, I always, every time I have a session, the following session, I say, so how was that session for you? Was it productive? What did you feel like you got what you needed so you can do some of the work in between sessions? And part of what I said, so we're meeting once a week or we're meeting once every other week. It's gonna be important to continue the conversation, at home. So were you able to do that, and what is it that you need? So I continually evaluate my practice in terms of seeking feedback from them.
To make sure that they are feeling like the therapy is meeting their goals.
Yeah, absolutely, absolutely. And then by making this a constant practice, then I hope that if something's not working, then they will feel free to open up and give me that feedback. I'll let them know I'm absolutely open to feedback, because it's not about me, it's about them.
Oh, and people have told me over and over that it's just not common for them to work with a therapist that is open to feedback. And so I think that is best practice, but some people aren't experiencing that. So just for listeners out there, that's something that you should probably discuss with your therapist. If you notice that they aren't asking ever for feedback and you do have feedback for them, maybe you can gently kind of say, hey, maybe we can talk about that next time. Let me talk about how the treatment is going for me. Because it's not about the therapist, it's about you and your family. So you should feel like you're served. Liz,
can I just add, sorry, when I start with someone, I always tell them that sometimes there's a term counseling that's used, and counselor, and a lot of people, especially from, Caribbean community, they're coming to counselor, they're coming for advice. And when I start with them, I said, I don't have advice. I don't have the answers for them, because I said they are the ones who are going to be able to come up with the best solutions for themselves. I said, I'm not standing in your shoes, so you are the one who will be coming up with the answers. What I have is questions. I have questions that will guide you toward the answers that will work for you. So that's how I introduce it, that we're going to come up with the solutions, but I don't have the actual solution. So I kind of put the power in their hands, so they know that they are the best ones to come up with that. So and usually that facilitates, when I ask them for feedback, they feel free to give me the feedback.
Ah, I see. Because I think a lot of times, sometimes folks don't come to therapy because they think, well, I've tried all these other things already, and they're not going to be able to tell me anything I'm not already trying. But sometimes the value of therapy is to actually partner with someone who's a professional, who can actually, talk with you about what you've tried already, build on those strengths, and just,
yes.
Kind of help to guide you through your own path versus kind of, as you mentioned, Marie, like versus telling you what you're going to do and giving you advice.
Yes.
So Liz.
A couple things. I want to comment on what Marie said about how she starts, and then I'll get back to the issue of working across difference. That's really interesting that Marie starts at the beginning. She meets with people individually as well as as a group to get more comfortable with who they are and what they need, and trying to empower their voices. That's something I almost never do. And just so people know, there's different ways of practicing family therapy. And part of it is we each have to work in a way that's comfortable for us. I prefer to talk to people together about everything, unless it's really clear to me that that's not able to happen because people are too afraid, or there might be a secret, or if things aren't going well, I might split people up. So we just have different ways of working in that way. And I have a preference for, I get confused. I like to be able to have people hear what other people are saying. And I also grew up in a family where there were a lot of secrets. So I get uncomfortable with meeting with people individually, because I don't want to end up carrying their secrets. But you don't have to. If you meet with people individually, you can say this, just so you know, all this information is going to go back into the room with everybody, unless there's some particular issues of danger. So it's just, we all work differently. In terms of working across difference, and can everybody work with anybody? I think we can't work with people if we don't have the desire, the intention, and the willingness to learn, or if we're too uncomfortable with something. So that stands with issues about working across difference, across racial differences, across gender differences, as well as particular issues. Like some people say, I can't work with men who've been domestically violent. Well, if you can't, you can't, and you shouldn't, right? So I think what's really important when you're working across difference is to be aware of the difference and to create a space where people are able to talk about it, where people are able to educate you about who they are and what's important to them, what's important to know about their culture and how that affects how they want their family to be, and to be humble. And that's true. I think our best therapy is when we're humble and we don't know and we know what we don't know. And that, to me, that's one of the gifts of being a therapist, is that we get to learn about so many different people and cultures and ways of living. So we have to just put our ego on the back burner and be open to feedback.
So you approach from a place of cultural humility, of just,
Yeah.
you know, you don't have all the answers. You're learning and appreciating and leaving room for people's differences, but also the awareness as a therapist of what you're comfortable with, your own comfort level.
Mm-hmm.
So if there are, as any therapist out there, if there's any particular kind of client that they personally don't feel ready to kind of work with, that they should be aware of that and you know, kind of act wisely, act accordingly.
Mm-hmm.
So one of the things that I wanted to talk about was how in your course you help trainees to kind of think about these issues. Is there anything specific that you include in your course, like readings or discussion, that helps people to kind of reflect on their own comfort level, actually, with working with people that are different from them, and maybe just kind of reflecting on their own biases?
I think there's several things, and that's the thing. One of the things that keeps me up at night is how to do a better job at that. And, you know, the more that the overt racism has been present in our culture in the last few years because of our government, who's running our government, the more I just have always felt it's an urgent issue. Like, we have to be able to share resources and everybody get along. Like, what is the point of living on this planet, right? We just, you know, it's like, I'm Jewish, and part of the Jewish ideology is about tikkun olam, which is repair the world. Like, part of our religion is to help repair the world so it's just for everybody. And, you know, within the Jewish culture, everybody doesn't interpret that in the same way that I do. You know, there's people who, you know, are not living up to that from my standard. So I think it's really important. And one of the things that I do, as you both know, is include a lot of readings for people that are really more directed to white people. You guys know racism from the inside out. You don't need to read about it, right? I mean, I've come to, and there's so much reading about all of that stuff that's on the syllabus. And I've come to saying, in the last couple of years, when we've been living in such a horrible pressure cooker, I've said to Black folks and other, you know, people of color who come to the class, feel free to do that reading and listening to videos and whatever it is, podcasts, if you want to, but don't if you don't want to. Like, you're living that day to day. So I think it's really, really important for white students and for me as a white person to always be learning. And, you know, another thing that really helps me is reading novels by people who are different from me, I've learned some of the most amazing thing from novels written by Black women, for example, you know, so, but that's, I'm digressing from the class. So I think, but I do share, you know, like, there are things that are on the syllabus that are more in the range of art as opposed to journal articles, you know what I'm saying? And so I think reading and immersing themselves and knowing more about these issues is really important. And then actually we have a new textbook, I was saying to you guys before the show, that in the context of learning every kind of family therapy theory, the author also talks about how it relates to social justice and cross-cultural work. So she's really integrating it. And the other way that I've been trying to integrate it more in our classes, even more since you guys have taken the class, is to use, when we do role play demonstrations, to create role plays where there are cross-cultural, cross-racial issues that we demonstrate how to work with in the class. And there are some moments where the theory and the practice come together in a way that is totally integrated. And actually, there's a guy named Elliot Connie. Have either of you heard of him?
No.
He's a Black therapist who's a big trainer in the solution-oriented family therapy world. And he did this beautiful talk that I'm going to share with students this year, when all of this terrible, like post George Floyd killing, when people were so traumatized, he did this amazing piece where he took solution-oriented questions and he asked himself solution-oriented questions to help himself with the racial trauma that he was experiencing. So I'm including that on the syllabus, and it's a beautiful piece of work. So I'm always searching for ways to bring the theory and the social justice pieces together.
Oh, it's amazing. So listeners, just want to remind you, you're listening to Black Mental Health Matters. And I'm Dr. Kerry-Ann Williams, and today we're talking about family therapy and how it can help strengthen Black communities. My guests today are Liz Brenner and Marie Pierre Victor. If you guys want to join the discussion or if you have questions, you can give us a call at 617-238-7111. We're also streaming live on Facebook on 98.1 FM, The Urban Heat, so you can drop a comment there. And I do have a question on Facebook from a Facebook user, Errol, who says, Marie, do you take calls from the individual family members away from them as a group? So like, would you take phone calls like that are separate from the kind of individual, separate from the group? Or do you discourage kind of those side, kind of calls? And if you do take them or not, why or why not?
So I do take them, and what I ask is that they bring it in the group session.
Okay.
Because I never want to just dismiss someone right off the bat in case there's really something serious. So I'll listen and I'll say, okay, it's going to be important to bring it up. And it may be that they need some coaching in terms of how to bring it up in the family session, but I do listen to those. And,
okay.
And then thinking about it would be the isolated phone call, right? If it starts becoming more frequent, then there's another pattern. There's something else going on there that I'd have to address.
Okay. And I just want to say welcome to our other Facebook users. I said Tamara, Richard, Tanya, Errol, Sandra. Thank you so much for joining us. And I think, Marie, I think you had maybe a comment that you had wanted to share to add on to what Liz was saying earlier.
No, I was just going to say that it makes me feel like I want to take the course again.
There are people who do take the course again. I've been taking it every year that I teach it. I take it and I learn.
Yes, there's so much to learn. And there's so many readings.
There's a lot.
All very good.
And so, I think about, also even just with couples counseling as well. It's definitely underutilized. Couples counseling is underutilized by Black couples as well. Mm-hmm. And so maybe I'll start with Marie, because you do couples counseling. What would you like Black couples to know about couples counseling and about the role that it can have, how helpful it can be?
I'll start my answer by talking about a case I had. This was a young couple. They were engaged and about to get married, and they decided to come to counseling so it was essentially, I feel like I was doing premarital counseling. Mm-hmm. So for them, they just wanted to know, they had some tension in the past, and to really go through, talk through the tensions that they had in terms of having a real successful marriage. So that's what I would say. It doesn't have, I would encourage people, it doesn't have to be when there's problems. It can be when things are going well, so you can learn what's going well, how you can do more of that, how you can strengthen those bonds with your partner, and then identify ways to, in terms of communication strategies, how can you talk about the stuff that's not going so well. So essentially, if we're going strength-based, it's really not wait when there's really big issues going on. Because if you start when things sound so bad, then you learn the foundation. You learn. Sometimes I call it kind of money in the bank. So you learn the little ways that you can adjust the little things, the little issues, so you can address the bigger issues later on.
Oh. So it's not couples counseling is not just for couples that are in a crisis.
That's how I'd say, and it's really about learning the patterns, in terms of your communication, and identifying strategies to address it. Yes.
Okay. And so, you mentioned the kind of the premarital. Is that something that you think is actually helpful too for couples that are considering marriage? Is it helpful to have even just like a few sessions with a professional to say, what are some things that we need to think about as we're entering, this kind of commitment?
I absolutely would encourage that people are, when I was getting married, I'm Catholic, so it's mandatory in the Catholic faith that you have to have premarital counseling with your priest. And it was a number of issues, potential issues with couples that they addressed. And so I would absolutely encourage that. It could be 3-4 sessions, it could be one session, but I think it would be useful.
One thing that I wanted to ask Liz about was, if a Black couple comes to you or a Black family, and as you already know that sometimes there's a little bit of mistrust of white providers. Would you as a white provider be offended if somebody were to ask you some of these questions like, what's your training on implicit bias and white privilege? What's your, when you think about what would be a reasonable question for a Black couple or Black family to ask you as a white provider to kind of, or any white provider to kind of check out whether or not you're open and if you're culturally humble, would you be open to that kind of discourse? And do you encourage, patients to ask you questions to kind of assess whether you're culturally open?
Yeah, I'm glad you brought that up because I was thinking before when I was answering your question about how to work well cross-racially, cross-culturally, that one of the things that I think was really important for white therapists besides cultural humility is having a thick skin. Because the last thing Black people need is to come in and see that they hurt their therapist's feelings, and see some white tears coming in their therapy session. We're not going down that road, right? And when I was a younger clinician, I mean, I don't think I cried in front of my clients around that kind of thing, but I've learned a lot. And so I think that having a thick skin is really important. Not taking things personally is really important. Realizing that, people don't know who I am. So whatever questions they're asking is not about me. And I welcome all questions. One of the things that I say to anybody who asks me questions to try to determine if I'm a good fit for them is there's all sorts of la-di-da that I can say. You can see how I can la-di-da it up. But the question really is, yes, I strive to learn as much as I can about all these issues and had a lot of training and I immerse myself in stuff. But the most important thing I think is come to a session if you feel comfortable. Let's work together for an hour and then see how it feels. Because whether I say the right words and whether it feels like the right fit in the room, I think are two different issues. Mm-hmm. And there was something that Marie said about couples, that I wanted to follow up on, if that's okay. This issue about whether couples should come in early and before there are big problems. And I love premarital counseling because just a few sessions, really, people are so excited usually about each other. And it's so easy to just do a few sessions and iron out a few little crinkles. And you hope that will have a good effect for their whole life. And even if they run into a big bump in the road, that if they have had a good experience, they'll come back. Because actually research shows, I don't know how they did this research, that couples wait 7 years too late before they come to couple therapy, where things have really been stewing and brewing for a long time. And so it is, and couple therapy is really a very, very hard thing to do because the therapist is stuck in the middle of two people who each want you to usually take their side. And it's very vulnerable as a couple to bring your intimate relationship to an outside person, but it can also be a beautiful healing thing because our intimate relationships are, I think, what we live for in a way.
Wow. So I guess this question could be for either of you. Maybe I'll start with Marie. For family therapy, what can people expect in terms of how long they'll need to do family? Because I think sometimes there's an impression that, oh my gosh, therapy is going to be forever. What would you say to who ask you that question, how long are we going to have to do this for?
I don't have a solid number, but what I say, and it depends on the issues, what I say to people is, can you commit to 4 to 6 sessions and then we'll reevaluate? And then this is a number I just used, the 4 to 6 sessions. And, I explain the process to them, what I'm going to do. And then I'll check with you after every session. How was it for you? What do you think is working? How do we need to tweak it? So that's usually how I address that. But I don't have, I certainly say it's not going to be a whole year, but I usually say 4 to 6, and then we'll reevaluate. That's usually when I kind of do treatment planning. I'll say, okay, we're going to do this for 3 months. We're going to do this for this number of sessions, and then we take it from there.
Okay, so kind of play it by ear, kind of see how they feel about how things are going, and then they have some control about whether they're going to continue on. And Liz, go ahead.
I was just going to say, I usually say 4 to 6 for me to understand what's bringing them to therapy, and then for me to have the chance to actually help them with some, identifying patterns, identifying communication strategies that would be helpful for me to do some piece of work with them, and then we can take it from there. Evaluate, yeah. And I'll pause it and I'll let this.
Oh yeah, and Liz, and what answer do you usually have for folks? And also, can short-term family therapy or couples therapy even be helpful if people are just meeting for a few sessions? Is it possible for that to be helpful?
Yeah, and I'm biased because I'm a family systems therapist, and I do work with individuals, but with a family lens. But I actually think that people can change more quickly in the context of couple and family therapy. Because actually, being in family and couple therapy, I think, is harder than being in individual therapy, because the therapist is not just there for you. And so it can be harder because the people that you may fight with and disagree with are in the room, and they're going to be sharing their opinions that or ways of being that you don't like or agree with. And so that's hard. But on the other hand, there's always more to the story,
True.
Right? So when you work with a couple or a family, you have so many different views on the story, and often that can help things to shift more quickly. So it's a little bit like taking a Band-Aid off fast rather than peeling it off slowly in a way. And we never, typically if somebody's coming premaritally, we might guess it's going to be a few sessions, but you just never know. And I ascribe to the same thing that Marie does, which is continuously checking to see, are we done? Is there more work? Have we accomplished the goals you came in for? Is there anything else you want to work on? And keeping it to be a short-term view and not knowing how long it's going to take.
Mm-hmm. And as you mentioned, the challenges of like couples counseling is the idea that each person kind of almost wants you to pick a side, and there's one person that often is responsible for the other person coming in for the couples counseling. Somebody that kind of said, hey, I think we should do couples counseling, the other person that kind of was brought in by them. But it also makes me think about when there are interracial couples, and the therapist, of course, is one race, and they share that race with one member of the couple and not the other, and how that might create even maybe more dynamics of, are you taking my side? Are you not taking my side? We're the same race. Do you guys sometimes see any challenges with working with interracial families or interracial couples who are kind of looking for you to take sides? I guess maybe I'll start with Marie. Have you ever seen that kind of pull to like someone wanting you to kind of side with them because of a shared race?
Yes, I can think of one couple I had, and it was a challenge for me. It was a challenge for me, and I'm curious to hear what Liz is gonna say. It was a challenge. The woman was Black. The husband was white, and he intentionally sought out the Black therapist for his wife, so she could feel comfortable, and so it was really hard. And like you say, it was some of the thing that one person was saying sounded logical and made sense, and then the other person was really reacting. And what I found out later on, there was a lot of trauma. Going back to what Liz had talked about, there's a lot more to the story than what is initially presented. a lot of trauma for one of the partners that really was affecting how this person was really reacting in the session and in the relationship. So I had to seek consultation to work with on that case. Yeah, it's very challenging. It's very challenging.
And Liz, any thoughts about any kind of pull when there's an interracial kind of dynamic?
Yeah, I think it's similar to the pull when there's a gender dynamic, which we always have, pretty much, unless I'm working with a lesbian couple. But then there's a difference because I'm not lesbian. So I think it's what Marie said is so important, which is that we have to notice if we are getting pulled, whether, there's some situations where I might have a pull with a interracial couple. There's some situations where I may not. It may depend on the particularities of that situation. But when we do feel that we're inside of ourselves, we may be overly aligned with somebody, we have to check ourselves and we have to rebalance. We call it rebalance the triangle, to make sure that we're not overly aligned with one person. Moment to moment we might be, but we have to rebalance. And if we're having trouble balancing and being in our therapeutic space where we need to be, that's when we do need to get consultation, peer consultation, pay for consultation, because what we do is a tricky business. It's not widgets we're working with, right?
So I want to ask you guys one last question. So I'm so glad to have you on the show. I think I probably didn't tell you about this question ahead of time, but I just wanted to ask you to talk about what you enjoy about doing family therapy, what you enjoy about your work, as kind of the final question. So Marie, tell us a little bit about what you enjoy about your work, and yeah.
So for me, it goes back to being a Black woman, being an immigrant woman, being Haitian, and working with immigrant population, even working with some Haitian families who are slowly coming into, accepting and understanding that therapy can help. So seeing that there's the acceptance and seeing that there's the changes that can be made. And when I do my continual, evaluation, asking them, so what's been working, not just that, yeah, it's been helpful, but trying to find out, so what exactly was helpful, and to find out it was maybe something I said, something I did. So to me, that makes it worthwhile. So doing this work, as much as there's all of the challenges, I talked about this interracial couple I had worked with, but especially families, helping them understand that, in terms of being more accepting. And so that absolutely brings me joy.
Okay. And Liz, the same question for you. What do you enjoy? And actually, there's a Facebook question for you, Liz, from Facebook user Errol that says, has a couple ever come back and thanked you, and how did it make you feel? So what do you enjoy? And then has anyone ever come back and thanked you?
Oh my God, that's such a sweet question. Thank you, Errol. Yes, occasionally people will send a note of thank you and updating me about their lives. And that's so beautiful. One of the things I actually love about doing this work is that sometimes people come and they end, and then they come back when there might be another challenge in their life. And I love to be able to have those kind of ongoing relationships where I see people grow and change and then come back and when there's another challenge. I mean, I think I just love the relationships with people. And growing up in my family with my dad who had bipolar disorder, I was really kind of in a family therapy role when I was about 5. And so I think I was then there was a lot of bad things that happened when my dad was manic, he was violent. And I think it helped me to understand it's not us and them. It's not those bad families who have problems. We all have problems on a continuum. We can all act badly on a continuum. I knew that I could love somebody who at times his behavior was terrible. And so I love to be able to help people take responsibility for the ways that they're being destructive to themselves and other people and improve their relationships.
Wow. So it's, you guys are doing such important work. And I'm so grateful that I took your course, Liz, and I'm so grateful for the work that you do, Marie, as well, and helping our Caribbean families be strong. Everybody knows from Jamaica, so I'm really grateful for your work. So thank you so much for coming on the show. And for the listeners out there, thank you so much for joining me today and listening to our discussion on family therapy in Black communities. You can join me next week again for Black Mental Health Matters, Sunday at 1 p.m. on 98.1 FM, The Urban Heat. If you have any questions for me throughout the week, any comments, if you just want to connect with me, I'm on Instagram and I'm on Facebook at Dr. Kerry-Ann. And so you can join me again next week. So thanks again for tuning in.